Hello, everyone. Today, I will be summarizing the key events from my findings from my work on improving preventative care and sickle cell awareness among young African American women in Newark, New Jersey. This community faces significant barriers to assessing preventative health care. Many women experience low socioeconomic status, high levels of stress, and limited health literacy, which makes it difficult to seek and receive consistent medical care. These challenges are intensified for African American single mothers in Newark who often face systemic racism within healthcare settings and a deep distrust of medical institutions. However, with culturally competent support, this community shows strong potential to build effective advocacy skills and empowerment around their health. Newark itself is a dense, diverse urban environment with many cultural and institutional resources. The city also struggles with environmental issues such as flooding, sewer overflows, and industrial contamination, which disproportionately affect low-income families. Fortunately, Newark's hospitals, libraries, transit hubs, and community centers create many opportunities for outreach and education. In terms of the health issue, racism, low health literacy, and economic barriers prevent many women from engaging with preventative care for sickle cell disease. A major challenge is limiting understanding of sickle cell inheritance patterns, which leads to late detection and unmanaged complications. Low confidence in self advocacy further reduces care seeking and engagement with health providers. My work draws upon leading researchers in this field, including Paula B. Adkins Jackson from UCLA, David R. Williams from Harvard University, and Lisa A. Cooper from Johns Hopkins University. Their research grounds this project in strong evidence about racial inequities, self-care barriers, and community-centered approaches. The intervention I designed uses trusted community locations, culturally relevant educational materials, and community health workers who share cultural backgrounds with participants. This approach increases health literacy about sickle cell disease, strengthens self advocacy skills, and expands access to screening and early detection. Research strongly supports this design. Studies show that culturally tailored multimedia tools and CHW support significantly improve knowledge and preventative behaviors. Marketing for this intervention would include text alerts, flyers, and other outreach, including social media campaigns and incentives to encourage participation. To evaluate success, I would use pre and post surveys, focus groups, and screening data to track both knowledge gains and participant experience. The primary upstream cause behind the health disparities we see is systemic racism, which shapes access to quality care at every level. If I could change one part of this project, I would involve participants even earlier in designing the intervention to strengthen cultural alignment. Through this work, I gained a deeper understanding of both the community and the cultural challenges they face, which strengthens my growth as a health educator. I applied theory, completed a needs assessment, and designed a culturally grounded evaluation ready intervention. Moving forward, this project will serve as a foundation for my future work in public health and nursing. Thank you.